Morning, good afternoon, good evening, everyone. Welcome to this session on innovative water solutions and migration response. Today, we are honored to present the Hygiene Corner on CHOPS Latin America migration response. And joining us today, we have Valentin Estrada, who is a WASH national officer in Colombia, and also myself, information knowledge manager in UNICEF Latin American Caribbean region office. So imagine traveling across the border, carrying only what fits in a backpack, and when you finally stop rest, someone hands you an hygiene kit, and you choose full of items you may not even need. Now imagine instead being invited into a safe space where you're treated with dignity, given the power to choose your own hygiene items, and even learn something helpful in the process, and that's our hygiene corners. So in the context of Latin America and Caribbean, we have the mixed migration flows. People in transit here are among the most vulnerable migrants, and they face significant challenges accessing basic services, including WASH products and WASH infrastructure. In 2023, 500,000 migrants heading north to Central America and North America from more than 100 countries crossed the Latin jungle between Colombia and Panama, and most of them departed from Nagakane in Colombia. But this have reduced in 2024 and 2025. And according to the refugee and migrants needs analysis in 2024, water access ranks among the top critical needs for people in transit. Many regions along these migratory routes lack adequate or even inexistent WASH and services, increasing also obviously the health and protection risks for this vulnerable population. Now we are going to have Valentin, who is going to talk about the problem.
Thank you, Victor, and good morning, good afternoon, and good evening, everyone. So what happened is in 2018, the immigration flows from Venezuela increased dramatically, and as a sector, what we did was start to give hygiene kits. But then through accountability for affected population mechanisms, we figured out that these hygiene kits were not useful because they were heavy. They weren't useful because the items, they need other items that we deliver. The kits are not focused on children and women and girls on the move, and so their need were not addressed. And also, we don't have chance at all to talk about hygiene risks or health risks and hygiene promotion with them. Next one, Victor, please. So we want to start showing you the solution through the video that we delivered to the migrants.
If you are in the Colombian municipality of Nagakane, you can visit the humanitarian store Somos on Mundo. In this space of UNICEF Colombia, you'll get free personal hygiene items and other supplies. There you will also have advice from trained professionals who will also give you tips for the route. In the store, you will find water filters, soap, toothbrush and toothpaste, diapers, sanitary napkins, alcohol, toilet paper, and insect repellent, among other supplies. Take only what you consider necessary. All the elements or services you provide are free for all migrants. The humanitarian store Somos on Mundo is located on a street near the Caribbean Pier. You can ask anyone in the place for the location of the store. You will see a notice with the logos of UNICEF Colombia and Foundation Safi. Once there, wait to be called and remember that only one person per family or group must enter. Share this video with people who may need it. Take care of yourself and others on the route.
So we figured out that having these shops would allow us to deliver supplies that they need. They choose from their needs. They choose from the capacity to carry on these supplies. But also, it gave us the opportunity to tackle and to talk about key hygiene messages, mainly water treatment and hand hygiene, but also there were other benefits, such as it's a methodology that is easy to install and easy to move, and also it helped us to understand what is the demand of the people on the move, what are the items that they need the most. So our response is more focused on the need and in the capacity of carrying on from the people. Next one, Victor, please. So what we do is first we welcome the migrants. The welcoming is very important because in this sense, welcoming is for us to understand and to know the family that is migrating. And this is very important because it helps us to activate other routes that can be in needs, for example, protection, education, and health routes. But also it will give us an idea of what are the items that the migrants could need. For example, if there is a girl or a woman, maybe they will need hygiene pads or menstrual hygiene pads or menstrual hygiene items. Then we do this quick hygiene promotion with the messages that I already told you. We had a COBO toolkit, a code tool for registration, but this was also for monitoring, for selecting and having this idea of how many products is going out and how many products we need to restock. But also it was a tool for accountability for affected population. Then they continue on their journey. And it's also very important to mention that after this initiative, I think in Colombia, we scale up. For example, here in Honduras, when they have this initiative implemented, but maybe with a different approach, but with the same system and methodology. For example, here in Honduras, they have already 4 hygiene shops, and they call them La Casita de la Higiene. And well, in this case, La Casita de Higiene works slightly different than Colombia's hygiene shops. So here in this case, people go and line up and wait for their turn to access the items. They go for the registry when a person takes their basic information, and then they ask for the products. That could be specific numbers of products, so maybe from 1 to up to
to 6 some cases, depending on the availability. And at the end, you go and you continue your transit. So these people in Honduras, they may be persons that are hosted in shelters or are one-day transit migrants. We also have, in the case studying here in Mexico, they have also a different approach. When they start with the hygiene promotion at first, and then they do the delivery of the customized or on-demand items. And rather than having establishments, we can see that they have these stands on public spaces as parks or gyms or open spaces for the public. And partners gather all their items and they distribute it on demand. And they also have their registry of what items are taken and what are the on the inventory, also the inventory list. So now we are going to talk about the cooperative advantage and disadvantage, and Valentin is going to explain a little bit of this analysis.
So this tool that we are presenting now is very useful for you if you want to set or to think which is better for you, if customized hygiene kit or cash transfer. You have to understand that that they are different. They have pros and cons. And for example, just for mention some, hygiene kit customized will be more cost efficient. Will give us with people in the move the opportunity to do some communication, some promotions. But in the other hand, maybe cash transfer will strengthening more easily the local markets, and maybe customized items. We need the storage, so while storage supplies can get a little bit damaged. So we need that and the restocking process. Next one, Victor.
Thank you, Valentin. And now we're going to talk about the impact and value of this innovation. We have divided this by 3 main users and persons that benefits. The first one are the users or beneficiaries, that are specifically the population in transit or people who move. So what's the impact on them? Basically, it's we meet their specific needs immediately because they choose what they need, or their most critical needs. Also, we improve their health, their protection, also their dignity. We reduce the financial burden of employing these items that could be expensive in some areas, in some transit zones. And also we deliver a competitive effective regulation because we take into consideration what they really need. So for programs and partners who are the ones who are assisting this population transit, obviously they contribute to sector objectives through the internal response plans or the itself partners response plans. There is a significant cost of production and also increase of efficiency on this delivery of the items. And we also have better procurement decisions and accountability through the data that is collected in these item shops. And for donors, obviously we have a high value for money. Efficient use of, because we have an efficient use of resources, because we know what people need. So the restocking that we use is based on all the trackings and the trends analysis that we see and we collect and analyze. Also, there is a scalable and adaptable for migration. Scalable because we already saw that it's implemented in several countries, and also it's highly adaptable for migration. We can use the same approach in different contexts and countries, and it's applicable. Also, it's a unique approach that we need to take advantage, and also we have a positive impact along the migratory routes that some cases don't have any services in different regions. So Valentin, go ahead.
And the scalability potential is obvious. Like we already mentioned, there we are in Colombia, Honduras, Mexico, but also Peru, Ecuador, Panama, and Bolivia have done this strategy. And even now in Colombia, we have our first mobile shop for response to an internal displacement people situation due to armed conflict. So this mobile shop goes through different shelters to respond to more than 50,000 internal displaced people. The other thing that is very important to mention is that we can integrate other humanitarian response, other sectors such as protection, health, and nutrition and education.
Thank you, Valentina. To finalize, we're going to talk about some lessons learned and findings. So basically, this model is effectively integrated with the promotion activities, as Valentin mentioned, but also with wash infrastructures, because there's some cases that these hygiene shops or in corners has wash infrastructure such as bathrooms and water points. So it can be a place to go, a preferred place to go for population in transit. Also, the importance of the facility of data collection that can provide key information for strategic planning. Other sectors also, as Valentin mentioned, have demonstrated interest in a specific item on this shop. Welcoming also online gift shops can identify also cases of protection and GVD. The products can also be changed through the feedback through AAP. Also, some of the limitations identified are related to local market availability and supply chain sustainability. Those are some key important aspects that we have to take into consideration. when we are implementing hygiene corner workshops. And also custom distribution is cheaper than in kind or hygiene kits, but CBA could be cheaper than custom distribution. And finally, for future sustainability of the service, face reduced funding and a long-term strategy is needed to ensure the sustainability of these hygiene shops. So in overall, the hygiene corner has shown that we can deliver support and aid in a way that is smarter and kinder and also more impactful for the most vulnerable persons and migrants. So this is the end of this session. And I would like to say thank you, and thank you also, Valentin, for your time and your support, and also for your leadership on this. We also invite you to read the field notes that was developed in 2023, who speaks about this innovation, and it's available on UNICEF site and other websites. So here you have our contacts, and see you on the next conference. Thank you.
Thank you very much.